Good morning, everyone. The topic for today's discussion is a Facebow. A Facebow is a caliper-like instrument used to record the spatial relationship of the maxillary arch to some anatomic reference points or points and then transfer this relationship to an articulate. It orients the dental cast in the same relationship to the opening axis of the articulator, also called hinge bow. Let's simplify this. We all know that the knowledge of the patient's mandibular movement is essential for any rehabilitation. The mandible moves against a fixed maxilla, and to accurately reproduce the mandibular movements, it is necessary to establish and record the tilt of the maxilla. In this picture, the red lines show the existing tilt or inclination of the maxilla in relation to the cranium. The tilt can vary with every individual. This tilt needs to be recorded and transferred to the articulator to obtain accurate jaw relation records. This tilt is recorded using a Facebow. A Facebow helps in transferring the orientation of maxilla to a semi or fully adjustable articulator. As we all know, to describe an object in three-dimensional space, we need at least 3 points. Similarly, to record the angulation of maxilla, a plane should be formed with at least 2 posterior references and 1 anterior reference. Posterior reference point commonly used is the center of condylar rotation. This is a repeatable border position and can be located consistently. And the line joining the center of condylar rotation is an imaginary line, is called a true hinge axis or the transverse horizontal axis. Anterior reference point is a third reference point located anteriorly in the maxilla, and this is either the infraorbital notch or nasion, and this will complete the plane. So, instrument that is used to record the center of condylar rotation along with a third reference point, thereby forming a plane to record the orientation relationship of maxilla to the cranium, is called a Facebow. Moving on to the types of Facebow. There are 2 types of Facebow, the kinematic Facebow and the arbitrary Facebow. Arbitrary Facebow is again divided into the earpiece type and the fascia type. Arbitrary Facebow is a device used to relate the maxillary cast to the condylar elements of an articulator using average anatomical landmarks. It is also called an average axis Facebow. It is most commonly used Facebow and is preferred for complete denture construction. The hinge axis or the transverse horizontal axis is approximately located. It positions the rods within 5 mm of the true center of rotation of condyle. As this method does not locate the true hinge axis, it will lead to a mild error in occlusion, but the inaccuracy being minimal, it can be adjusted during the insertion of the complete denture phase. The earpiece type. In this type, the external auditory meatus is considered as a reference point to determine the center of condylar rotation. The condyles are located at an approximate distance in front of the meatus, and this is compensated for in the articulator by mounting the Facebow behind the condylar center. This type of Facebow is easier to manipulate clinically. In the fascia type of Facebow, the center of condylar rotation is arbitrarily marked as 13 mm anterior to the middle of the tragus of the ear on a line drawn from the outer canthus of the eye to the middle of the tragus of the ear, also known as the canthotragal line. So we have the outer canthus of the eye over here. This is the tragus of the ear. The midpoint of tragus, you have a line joining the outer canthus of the eye to the midpoint of tragus called the canthotragal line. So it's represented by this line. and you mark a point 13 millimeter anterior to the middle of the tragus on the canthotragal line, and this point is taken as the center of rotation for a fascia type, and the condylar rods are placed on this point. Kinematic Facebow. A Facebow with adjustable caliper ends used to locate the true hinge axis or the transverse horizontal axis of the mandible. As it locates the true hinge axis, it is preferably used in full mouth reconstructions, and it usually requires a fully adjustable articulator. So let's consider the principle behind the kinematic Facebow. When we consider the rotation of a circular object, only the central point rotates. Any other point within the circle will show a translatory movement. Similarly, in the condyle, the center alone will display pure rotation. So this principle is used to determine the true center of rotation. The condylar rods are first positioned arbitrarily, similar to the fascia type of Facebow at a point 13 millimeter anterior to the auditory meatus on a canthotragal line. Next, the patient is instructed to make opening and closing movements in the centricrelation point. The opening should not be greater than 12 millimeter. This is because we know that up to 12 millimeter, the condyle shows pure rotation. If the opening is more than 12 millimeter, the condyle will then begin to translate rather than rotating. The position of the condylar rod is shifted around the arbitrary mark until it shows a pure rotation. Now, this point is the center of condylar rotation. So, we have the bite fork attached to the stylus and a tracing plate, and the point where the stylus only rotates on opening up to 12 millimeters is marked as the center of condylar rotation. Then the condylar rods are locked and the Facebow assembly is removed and mounted on an appropriate articulator. So let's move on to the parts of a Facebow. The basic parts of a fascia type of Facebow is described. So we have, the basic parts of a earpiece type of a Facebow is described. So we have U-shaped framework, condylar rods, bite fork, a transfer clamp assembly, orbital pointer with clamp. U-shaped framework. This is a U-shaped metallic frame to which all the other components of the Facebow are attached. It extends from the temporomandibular joint on one side to the temporomandibular on the other side and is at least 2 to 3 inches anterior to the face to avoid contact. Condylar rods are two metallic extensions fitted on either end of the free end of U-shaped frame, and they are placed on the determined center of condyle. In the earpiece Facebow, the condylar rods are inserted into the external auditory meatus, while in the fascia type, the condylar rods will be locked into position on the line 13 millimeter anterior to the middle of tragus on the canthotragal line. The calibrations on either sides are equalized to centralize the Facebow and then locked in position. Next, we have the bite fork. This is a U-shaped rod which is attached to the maxillary occlusal rim while recording the orientation jaw relation. It is attached to the frame with the help of a metal rod called the stem. The bite fork should be inserted about 3 millimeter above the occlusal surface onto the occlusal rim. Sometimes the bite fork is attached to the occlusal surface of the rim with the help of impression compound. This is done in order to preserve the occlusal rim. This is the locking device with 3 screws. The screw 1 helps to maintain the vertical alignment. The second screw helps to keep the Facebow centered, while the third screw is for the anteroposterior adjustment of the bite fork. Next is the orbital pointer pin. This helps in marking the anterior reference point. It is adjusted after marking the anterior reference point on the patient. This enables the transfer of the third reference point. Moving on to the clinical procedure for recording orientation jaw relation, and this is using a fascia type of Facebow. The maxillary occlusal rim is constructed based on the guidelines as previously described. It is then inserted into the patient's mouth and contoured. Next, a point is marked 13 millimeter in front of the middle of the tragus of the ear on the canthotragal line on both sides of the face. The bite fork is flamed and attached anteriorly to the maxillary occlusal rim 3 mm above the incisal plane and parallel to the occlusal plane. The maxillary rim with the attached bite fork is inserted into the patient's mouth. The parallelism and centering of the bite fork are verified. The U-shaped frame is supported by 2 fingers and gently rotated and inserted into the stem of the bite fork in the patient's mouth. The condylar rods and the condylar heads are then placed in the patient's right and left condylar centers on the previously marked points. The third point of reference, the infraorbital notch, is palpated and the orbital pointer is set to the third point of reference. The condylar rod readings are equalized on both sides and the locking screws are tightened. Following this, the orbital pointer is also tightened in position. Once the entire apparatus is in position, the condylar rods, the orbital pin, and the bite fork are verified for any movement, alignment, and parallelism. The contoured mandibular occlusal rim may be used during the transfer to stabilize the maxillary rim. The Facebow record is removed from the patient by loosening only the condylar screws. The record is now ready to be mounted on an articulator. This completes the Facebow transfer and then it is transferred to an articulator. Mounting on an articulator. The articulator is programmed first. The incisal guide pin is set to the correct jaw separation. Next, the horizontal condylar inclination is set at 40 degree and the Bennett angle at 20 degree. The Facebow record is now mounted on the articulator as follows. The condylar rods are attached to the auditory pins of the articulator. The bite fork is stabilized on the tilting support bar provided and the orbital pin is made to coincide with the orbital axis plane indicator. The incisal pin is locked with its lock screw at 0 on calibration and the incisal table is set horizontally. The upper member of the articulator is swung open, plaster is mixed and placed on the cast and the upper member is closed slowly until the incisal pin fully touches the incisal table and the upper mounting plate is covered with plaster. Excess plaster is trimmed. Once the plaster is set, Facebow is now removed by loosening all the locking devices. So with this, we have come to end of today's class. I would just like to mention the importance of Facebow as a summary of this class. We know that the knowledge about the patient's mandibular movements is essential, and to accurately know and record the patient's mandibular movements, we have to know the tilt of the maxilla in relation to the cranium, and this tilt is recorded by Facebow. So Facebow is an instrument, a caliper-like instrument used to record the spatial relationship of maxillary arch to some anatomical reference point or points and then transfer this relationship to an articulator. It also helps to orient the dental cast in the same relationship to the opening axis of the articulator. And it is also called a hinge bow. So we should also know that there are two types of Facebow, the kinematic Facebow and the arbitrary Facebow. In the kinematic Facebow, the true hinge axis is located, while in the arbitrary Facebow, we are arbitrarily determining uh, the condylar rotation using average anatomical landmarks. And the five basic parts are the U-shaped frame, the condylar rods, the bite forks, locking device, and the orbital pointer pin.